So first, I would like to thank Jay for the brief introduction just now, and thank you to all the audience for coming in today. So yeah, our topic today, I'll be sharing about a very general but very essential topic that you need to keep in mind when you are continuing your study in the UK, which is your well-being in the UK. And hopefully you can get some tips and support from me as well. So moving on, before I start my presentation, I would like to introduce myself first. So my name is Haziq. Uh, I finished my SPM in MRSM Kuantan, and then I got a scholarship to continue my A levels in KYUEM. And currently, I'm a second year student studying accounting and finance from the University of Warwick. So the reason I decided to choose this topic is because before I enrolled into KY, I was diagnosed with maturity onset diabetes for the young, which requires insulin as a medication. So when I was in KY, before flying to the UK, I wasn't sure what support was available for me. So I hope that by sharing my experience of my worriness before flying to the UK to you guys, I hope you guys can take back some insights from it and hopefully you can get some takeaway points too before you continue your study into the UK. Moving on, let's just go on a quick overview of what I'm going to share about today. So we're going to go through the introduction first, of course. So the second one will be pre-departure preparation, what you need to prepare now when you are still in Malaysia. And then when you get there, the usual process of getting medical support. And then we're going to go through booking appointments in detail, getting prescriptions. I also going to list what are the supports that I got from my university and also the healthcare system. And I'm going to list out a few tips for maintaining your physical and mental well-being there. And we're going to close with that. So introduction. What constitutes a good well-being? I think there are three elements that you need to keep in mind when assessing your well-being. Those three elements are, first one, you need to be healthy. The second one, you need to be happy. And a combination of these two will make you feel comfortable in the UK. So if you think you are missing one of this element, I think you need to assess whether you have a good well-being or not in the UK later. So how to get these three elements? Still introduction, I would like to introduce a bit about what you are going to deal with in the UK. The UK healthcare system is a public healthcare system like here in Malaysia where most services are subsidized. It is spearheaded by the National Health Services or NHS for short. So for consistency's sake, there are a few terms that I would like to go on first because it's very unfamiliar here in Malaysia. So general practitioner or for GP for short are just normal doctors that you can find from your local clinics that have like general medical practice, and prescription is just another term for medication drugs like pills, injections, and oral medication. Still in the introduction, so I imagine that if you are going to the UK, you will apply for your visa. If your visa is approved, meaning that you have paid the immigration health surcharge or the IHS, you can access the National Health Service NHS for free. But I need to highlight that this excludes a few services, meaning that you have to pay unless stated otherwise. One of them is your eye care, things such as contact lenses, sunglasses, and then dental treatment, braces, scaling, chipping a tooth maybe, and then prescriptions. Yes, for your medication and drugs that you're going to be prescribed, you need to pay for those as well, unless stated otherwise. I would like to disclaim that. So moving on, imagine that most of you are still here in Malaysia. So what to prepare now? So the first thing, this is all based on my experience. The first one is to get in touch. I imagine that right now you are receiving a few emails from uni representatives as well, from your university that already gave you an offer. So right now is the perfect time to, engage with them, ask them if you have any question, because those union representative are expecting question for you as well. So ask them what support is available if you have a medical condition, what should I do when I get there? Because although some of the processes are general, but then I think most union require specific processes as well. So I did that. I did that before I flew to the UK. So I think I've listed a few examples that I've gotten, like the replies that I've gotten when I inquired them about my diabetes problem. So it's quite long, but I'm gonna like summarize it for you. Basically, there's nothing for you to worry about because already all your needs are catered to, and all of the support that you are expected and beyond are available for you as well in the UK. Or alternatively, you can also check your university website. Either it's your firm, insurance, or any university that you are interested in. There's this student. It's always they always have the student support tab where you can just click and you can have access to various information there. This is a few examples from UKEC partner university that Jay listed before. So it's very easy to find. Just go onto their website and find these tabs. So if you click on those tabs, although we are focusing more on healthcare support here today, but then I also need to remind you that when you click that button, there are various of other supports available for you too in order to cater to your needs in the UK. So these are also a few examples that I got. So other than health and well-being support, University of Portsmouth also offered finance and money support if you have financial problems, and also learning academic support if you if you are struggling with your modules and your study. And those are very general, but then if you want it to be more specific, there you can see like the other example that I gave. It's more detail on what the support available for you other than what are we going to cover today, which is healthcare and well-being support. So the third thing that you need to prepare now, if you have a medical condition, I would say preparing a valid document that shows your condition and prescription in order to make the process that easier, as they can see that, oh, is the proper term that I'm using for describing your condition and prescription. And then me myself, I got my doctor's letter from a local hospital in Terengganu, so it was quite helpful because like the GP, they can easily understand what my problem is without me explaining so much about it. And then if you have any prescriptions right now, for me myself, I require insulin, right? So I imagine like problems such as asthma needs inhaler, so it's best for you to prepare a minimum of 1 month worth of prescriptions. This is just for you like to cater a while for your self need, because the process might take a while, but then I would say like a 1 month worth of prescription is already more than enough to cater for your self need there before you go into NHS and access their services. So this is what I brought before I flew there, an icebox, and in the icebox it contains insulin. So you don't have to worry about your baggage allowance because medical essential prescriptions are excluded for your baggage allowance, so don't worry about it too much. And then we're gonna go through the usual process of getting into NHS there. So this is when you are already in the UK, all right? So you should be registering with your local GP as soon as you arrive, meaning that you have to contact your university healthcare center as soon as you arrive. Don't delay it, because when you are unwell and when you want to book an appointment, you don't want to deal with all the paperwork. So I think it's an easy process for you to go through. Everything now is done online, so I think you are familiar with that. And then when you are registered under your local GP, then you can start booking appointments with your GP. We're gonna go through booking appointments in detail later. And then you can, after you book appointment, this is for people that have urgent need for prescription, you can book directly after that and then get your prescriptions from your GP. However, if it requires a specialist where your prescription is not under your GP jurisdiction, like me myself, I require a gynecologist to actually prescribe me. So you'll be referred to a specialist in hospitals. So before going to the specialist, proceed with any required checkups such as, like blood tests, urine tests, things like that. Don't worry because it's all free. And after this, your regular appointments with the specialist, you meet him or her every 3 to 4 months. But sometimes annually you are required to see your nurse, university healthcare nurse, and your local GP as well annually, just for like their safekeeping and record keeping. So like I said before, we're going to booking appointments in detail. So this is just based on my research. This is just a general process of booking appointments if you are there in the UK. The normal procedure is when you are booking an appointment, you need to book early in the morning, like before 9 a.m. to book the slot for the day. You cannot book like 2 weeks in advance. You cannot book for tomorrow. You need to book when you call early in the morning. You need to book for the day itself. So you might have concerns right now. What if I can't secure a booking appointment when I'm very sick? So this is one of the alternatives that I'm suggesting, which is to go to NHS walk-in center. So check on the available walk-in centers. Like for me, myself, Warwick is near to 2 NHS walk-in centers. So you can just go there if you are unable to secure an appointment during the day because all the slots are booked. If you haven't registered your GP yet, or your GP is unavailable, but prepare your BRP or bioresident permit. If it's not an urgent medical problem. From my experience, I have this skin problem that I need attention to because it was itchy, and then it was uncomfortable enough for me to stop me from doing the things that I like. So when I called in the morning, it was fully booked, and then they suggested like going to NHS walk-in center because it's not an urgent medical problem, and it should be the attention should be like minor, and luckily it got solved like in 2 days. I recovered in 2 days just booking from the NHS walk-in centers. The NHS walk-in center, I would like to highlight that the waiting time is quite short, so you don't have to worry about long waiting time. But firstly, you need to go through your GP first. If you are unable, then go to the NHS walk-in center. And then these are a few of important NHS numbers to note. So 111 is a line for urgent treatment but not life-threatening, such as a few examples that I've listed, but not limited to, like bites and stings, vomiting and diarrhea, if you have suspected broken limb from playing sports. So this is the number that you want to call if you have these sorts of problem. However, if your GP is available, you should put your GP as your first point of reference, meaning that before you call 111, you need to make sure you call your healthcare center first and consult with the GP first. Because the normal procedure of 111 dial line, they usually consult with your GP anyway, so it's not worth doing a double work. And then you have the normal 999 line for life-threatening situations, such as you are involved in an accident, your friend is having a heart attack maybe, and you are suffering from a severe bleeding that cannot be stopped. And yeah, that's it for booking appointments. And now we are moving on into getting prescriptions. So like I highlight before, prescription is just another term for medication or your drugs. A normal prescription cost right now is £9-15 for each prescription, no matter how cheap or no matter how expensive the prescription is. So when you book an appointment with the GP, if you have any problems, they will give you prescriptions. So when you get to the pharmacy to get your prescriptions, this is what you have to pay. So if you get like 2 prescriptions, let's say a pill and a cream, that's ×2 already. However, unless stated otherwise, you don't need to pay for your prescription. This is where medical exemption certificate comes in handy. Medical exemption certificate listed a few medical conditions that you can apply to get free prescription. So the list is quite short, but I've listed the link below for you to go on and check whether you are eligible or not, but what I can say is diabetes is definitely included in the list, but other common problems such as asthma is not included in the list. So just check whether you are eligible or not if you are currently having any medical condition. Although it's a certificate, but then it's really a card. It's not that big, so you can just put it in your pocket and bring it and show it to the pharmacy to get prescriptions. So this is the picture for the medical exemption certificate there. And then we're going to go through the process of applying medical exemption certificate. First, you need to talk to your GP, your nurse, or your pharmacy whether you can apply or not. This is after you check the link before this. So just make sure you are eligible before inquiring more about it, and collect the form from them. You need to post it to the NHS HQ. It usually costs you less than £2, I would say, for posting stuff in the UK. And then you will receive the cards in 10 days. And if you have been purchasing your prescription before, you can get refunds for it. And then this is another thing that you need to keep in mind, which is a repeat prescription program. Like me, myself, I require insulin every month, right? So I'm eligible for a repeat prescription program because I can easily apply each month. So we're going to go through the process first. The common process is just talk to your GP, your nurse, or your pharmacy. And there are various services to choose from. This depends on what your GP can cater to. There are more than 10 applications available, but I did choose patient access as my application of choice. So this is one of the interface that I'm using. So as you can see, your prescription is there, and then you can just go there and click request now, and your prescription will be processed. So where does your prescriptions go to? So you need to choose a pharmacy to get your prescription. This pharmacy should be your nearest pharmacy and the easiest to access to. For me, I pick a pharmacy that is in the University Student Union. So after classes, I can just drop by and get my prescription. But it depends on your university as well. So there's Lloyd's, there's Boots, and other small private pharmacy that you can choose from. Yeah, example of what Boots and Lloyd's logo looks like. And then after you click request now, you will get your prescription in 2 or 3 days. And if you don't have the medical exemption certificate, you need to pay for your prescriptions. So this is a few extra tips from me for you, to save money, because I imagine right now you are still in Malaysia. So the possible medication that you can bring from home are things like Panadol, if you have any fever or cold, sore throat lozenges, cold and cough medicine, because you're gonna arrive and it's winter there, so it can be quite cold. Then stomach problems medications such as indigestion, and this is just nasal stick when you have a blocked nose, because you don't want to go to a doctor for really minor problem, because the process can take quite long, but not that long for you to have trouble too. So that's it for getting prescription. And then I'm going to tell you about the supports that I got from NHS and also from the university. So from the NHS side, I got free blood tests with valid documents. So the doctor will give you some documents to fill in, and then you can claim for free blood tests. Free flu injection before winter. This is very important to avoid any diabetes complication. Regular checks with the nurse, the university healthcare nurse, or the hospital nurse. Just a food check or blood sugar check to make sure there's no diabetic complication. Eye checks as well, and a glucometer and constant supply of test strip. This is something that I need to pay here in Malaysia, but I got it for free in the UK. So a glucometer is just a device for you to check your blood glucose, and that's the picture of it if you're wondering what it is. And then normal session with dietitian. This is for me to adjust my diet for my diabetic needs. And then other supports that I got, support from university diabetic community. I think there's always a community for everything. So check with your university for that and register with them. I also receive like regular emails to check up on my condition, whether I have problems or not, whether I'm settling down well or not. And then this is confidential, like people won't know that you are classified as a student with disability, but it's important for you to like to get special arrangement for exams and such. Like if you need more time when you have problems and all. And then at the end of the year, I will receive like regular survey for if you have any opinions or feedbacks for your university to improve on what support that you can get as well from the university. So last but not least, this is a few top tips for well-being from me. This is mostly relevant to your mental health, but if this is more to avoid being in those problems. But if you are thinking you are suffering from depression or anxiety, your first point of contact should be your GP anyway. But this is just to like to avoid those problems. So the first one is don't keep it to yourself. I would say like don't bottle up your problems. Find someone to talk to and tell them your problems. It's all about balance. Find some time for you. Instead, I know study is important, but find some time for you to like balance your study and your social life as well. Like for me, I joined my badminton club. I also joined M Night just for me like to have fun besides studying. I also went to a few stadiums, and also like you can go for a short vacation during the weekends just to keep that balance going and stay connected, like having normal everyday life, like birthday celebration or hari raya celebration for you, just to release tension from yourself. So this is a few pictures of my memories in the UK, as you can see. And then don't compare yourself with your friends. Like every journey is unique in their own way. So don't compare your experience with your like classmate or your friends. Make sure you are in your own pace, and like it's important to keep going steadily as well. And then like track your progress. I know like because recorded lectures are available in the UK, like most people tend to like postpone their lectures, but it's not worth it doing 10 lectures in 1 week before your exam next week. It's gonna bring a lot of problems. So just make sure that you are up to date on your study as well. Like focus on your lectures, focus on your tutorials, do the coursework just in time to make sure that you are not overloaded with work at the last minute. So that's it from me. For the conclusion is just keep in mind that every type of support that you think that you need and you are expecting to get is available there in the UK. So this is just a quote. Basically, if you are reading it right now, I'm just going to summarize it for you. Just go at your own pace. Make sure that you cater to your self-need first. I think that's all from me. I'm gonna pass back to Jay. Thank you very much for coming. Thank you very much for listening. And I hope you succeed in what you are doing in the UK and hopefully get that degree, all right. Thank you.
Hi, thank you, Haziq. I think maybe, all right. Okay, all right. So can Haziq. All right. So everyone hear me clear enough. So thank you everyone for really listen to Haziq, and thank you Haziq for so generous to share about your experience, how you get medical support. This is not the end section yet, so I will have a prize draw later on. So please stay with me until the end. And now we are in Q&A section. I understand that this topic might be a little bit technical for all of you here, and you are still not yet in the UK, and you might not have any question that you want to ask. But Haziq is a current Warwick student, currently a year 2 student in accounting and finance degree. So yes, so if you do have any question that you want to ask or you want to interact with Haziq, you can do it now. You can just drop your question in the chat box and we'll address it now. Let me see if there is any question that I could check, we can take. All right, so this is the question from Amira. Are typical medicine like Panadol, cough syrup expensive in the UK? All right, so I believe Haziq will be able to take this question.
So I hope you can hear me. Typical prescriptions such as Panadol, cough medicine, and in like pills or oral medication is readily available from whatever convenience store or your pharmacy. I would say like a typical Panadol will cost you like £4 for a box of 16 pills. So I don't know, it's quite expensive. You can get a meal for that price. So if you can get it from Malaysia, like standby early, I would say I would definitely suggest that.
All right. Thank you, Haziq. So basically, Haziq, sorry, can you mute? Yeah. So basically, for advice from Haziq is because Panadol and cough syrup, all this is quite a common sickness that you can get. So if you want to save more money, then you can get ready this before you arrive to UK, right? And one question from Diana. My prescription medication are controlled and is under stage 4 in the UK. Do I need a permit to bring my 1 month worth of medication? This question is kind of specific, so we would really advise you to really speak to your doctor here to seek for their advice. But I think Haziq may be able to also share his experience about this. Right? So let me pass this to Haziq.
Hello there, Diana. So I'm not quite sure what medication are you talking about, but for me, I did bring an ice pot with insulin in it, with ice packs as well. That is easily like already like 3 kilos. I did not require any permit for me to bring those insulin as long as I have a like a doctor medical letter. So unless you specify what medication are you talking about, I'm not quite sure. Do you need a permit or not for that? But otherwise, you can go to NHS website and check for it first. If that answers your question.
All right. Haziq, sorry, you need to. Sorry. So yes, I hope Haziq to provide a little bit information for you, Diana, and I really encourage for you to speak to your doctor directly as well, and also speak to your university about this, so to make sure that they can give you a more specific instruction for this. All right. So thank you, Diana, for the question. So we have one question from Payan. What medications should we bring that is available in Malaysia but not in the UK? Haziq, do you think we will be able to text this question?
I hope you can hear me. So I cannot specify any medication now, but then I remember like a few times that when I'm looking for specific brands of medication, it's not there in the UK. So if you are comfortable, like if you have any specific brands, you might not be seeing it in the UK. So if you are comfortable with specific brands, you should bring that from Malaysia and not like expecting it to be in the UK for you. But I cannot list like any types of medication because I think all medications are available for you there in the UK, but it depends on whatever you're comfortable with. Like for Muslims, right? I think like certain medication has gelatin, which is not available, which is not advisable for you for Muslims. So you should be bringing your own medication as well if you are expecting to, like to cater for your self need.
Yeah. Yes. All right. So I actually Okay, so I have one more question from Junseng. Is asking about is UK have any clinic is in traditional Chinese medical science, or if I need services like acupuncture, is it available in any maybe private clinics or any clinic that is for him to access? So maybe I will let Haziq to share his experience, like whether he see any acupuncture center in UK or not around his university. So I will pass this question to Haziq.
I think that's a very interesting question. From my experience, I've never seen a traditional Chinese medical science services such as acupuncture, but if you go on to NHS website right now, I think you can check for those type of services, but I don't think it's not as easily accessible, I would say, but uh, certain clinics might offer it, but it's not under NHS service, I would say. It's not easily accessible.
All right, so sorry for the technical things. So for ginseng, so if you would like to look for more services like this, so maybe it would be best for you to really approach your university representative. So I think they will be able to advise you better for this. And we have one more question from Shooting. Hi, what is the procedure of registering with GP? Is it for everyone or just for students who have medical condition? All right, so I will pass this to Haziq again.
The question was whether those processes are for like normal people or just people who needs medical condition. So you need to make sure you are registered under your local GP as soon as you arrive in the UK, whether or not you have medical condition. But if you have medical condition, okay, let's go if you don't have any medical condition first. After you registered, then you are good to go. But if you have a medical condition, you need to book an appointment with the GP to tell them about your problems and get prescriptions from there. I hope that answers your question. So if you don't have any medical condition, just register yourself with the GP and book an appointment when you are feeling unwell. But if you have a medical condition, book an appointment directly straight after registering with your GP in order for you to get your prescriptions.
All right, thank you, Haziq. So just now all right, so we have one more question from Diana as well. Haziq, sorry, can you mute your mic? Yeah, thank you. So how long does it take to register with the GP and get specialist attention if you have an illness that requires one? So just now, I believe Haziq already shared that for his case, he actually very fast for him to register with GP and to get specialist extension. Would you mind, Haziq, can you share like how long would you take you to meet the specialist?
It took quite a short time for me to register with a specialist because after meeting with your GP, if it's an urgent problem that needs like urgent medical attention, I would say the process you can get it straight away in the week. So like in my case, it only like took a week for me to go to get an appointment with a specialist and get prescriptions from there. And then after you meet your specialist for the first time, you're gonna get like regular checkup within like once in every 3 to 4 months.
All right, so I hope Haziq to answer your question. So we can take one more question for now. So let me see, is there any? All right, so I have one question from Jason that he asked about like, am I allowed to go to other GP other than the one that I've been registered with? So this one, not sure if Haziq, you're able to share about this. Like, have you approached any other GP other than the one that you registered before?
I did inquire about other GPs as well when I went to the NHS walk-in centers, but when your GP should be your first point of reference for any of your cases, because they are the only person that have your medical record. And then when you go to a different GP, you are required to how do I say this, say that you want this information to go to your GP or not. So that's what happens when you go to another GP at NHS walk-in centers. But if you want to go to a random GP, I think you cannot go through that because you already have a registered GP, and the process of booking an appointment with your GP is quite simple for you, like to not go through the hassle of going to another GP. Unless it's an urgent medical condition where you need to call 999, then that's another problem where you can just access any like available medical service which is closest to you.
Thank you, Haziq, to address the last question. And I think Haziq, to answer this question, like if you at any point your first reference point should go back to your registered GP. If you can reach your GP, then you can look for other alternative. And this one, I would encourage students you all to really check with your university before even you fly into the UK, and connect with your university representative to ask more about this and to receive a more specific instruction. All right. So yes, so we have come to the end of this session.